Alright, we got cut off, so I'm gonna try this again, starting off where I left off. Which I believe was the ophthalmoscope. And so I'm gonna check the red reflex, and I'm just gonna have you look straight. I'll say an arm length away, and just go in. And now I'll look inside her eye, look deeper. And the back of her eye, the veins are visible. There's no excess fluid, there's no popped blood vessels, there's no blood, and there's no swelling. Everything looks pretty normal. We'll go to the other side. Good. And then I'm going to have you look right at the light, in the macula. So the eyes seem to be intact. No swelling, there's no changes. And now we'll move on to the nose. I'm going to check for symmetry. Looking at it, it looks similar. It's right in the middle of her face. You can palpate it. Just right down the center is good. I'll check for check the nostrils for patency. Go ahead and okay. And once more. Good. And I'll visibly look in the nostrils. And the septum is intact and straight, and there's no over mucus. The mucus that is there is a normal color. It's whitish green, and it's not running, and it's dried onto the cilia, which is there to protect the nose. So it doesn't look infected, no bacteria. It's patent. And I'm going to check the cranial nerve number 1, which is olfactory, and it's a smell. So I'm going to have her smell this common spice from the kitchen. I'm going to have her tell me what it is.
Cinnamon?
Good. And it is cinnamon, and she passed that test. I'll check the sinuses. So I'll just start by just palpating. Any swelling? I don't feel any swelling, any tenderness or pain?
No.
Anything progressive? Any pain?
No.
No swelling, no pain. The face feels symmetrical and good, and that is good. So now we'll move on to the mouth. And I'm just going to look at it. It's similar. The lips are pink and moist, which is normal. And I'll just have you open your mouth and look at the teeth. They all seem intact. The gums are pink, moist, and the hard palate and the soft palate. Okay, can you stick your tongue out for me? Good. And say ah. Good. The tonsils are intact, there's no swelling, there's no visible signs of trauma or discoloration or bacteria or infection. And I'll check her larynx, so can you say ah again?
Ah.
Okay, good. Check the trachea is nice and straight. And then we'll palpate the thigh. Any pain?
No.
Good. And we're going to check the cranial nerve number 9, the glossopharyngeal, 10 vagus, and 12 hypoglossal, by having you go ahead and swallow. Okay.